8:33, everybody. You know, May is Stroke Awareness Month, and while many of us think of strokes as something that only affects the elderly, startling new data shows that they're happening more often and in younger adults.
Yeah, joining us to talk more about this, the warning signs, the rising risks, is Dr. Susan Law, neurology attending physician at NYC Health Hospitals, Kings County. Good morning to you, doctor. Thanks for being with us.
Oh, thank you. Thank you for inviting me.
Of course.
So the numbers are pretty startling, aren't they? What are the trends with strokes?
So as we know that about 800,000 strokes happen annually. Every 40 seconds, someone's having a stroke.
Wow.
And every 3 minutes and 11 seconds, someone actually dies from a stroke.
Oh my gosh,
it's one of the
scary.
leading causes of stroke. Stroke is one of the leading causes of disability in adults. So it's one of the most concerning trends where it's actually increasing between ages 45 and 65.
Wow, that's young.
And some people can be having a stroke and not realize that they're actually having a stroke. So there's a simple tool that you can use, right? And it's with the acronym FAST.
Yes, it's a screening tool that we actually, the EMS people as well as the hospitals use it every day on a daily basis. F is for face, facial droop. A is for arm, arm weakness, and leg weakness. Speech is for slurred speech, and T is time to call 911.
Yeah. Why is it so important to act immediately as soon as you have these symptoms?
Because there's treatment available. You know, if you go and have symptoms of stroke, you can actually go to the nearest stroke center or hospital and receive treatment. There's two lytic agents that are available called TPA or alteplase, or TNK, which is tenecteplase, both FDA approved for treatment for stroke. And if you come in on time, you can actually qualify for this medication. And for rare instances, you can actually get surgery and get a mechanical thrombectomy where you can actually take out the clot. And the sooner you get this treatment, the more likely you're going to get recovery.
How does that medication work exactly?
So 87% of all strokes are ischemic strokes, which is caused by a clot impinging the artery that robs the blood from going into the brain. So what it does, it works like a Drano. It just litigates, lights this little clot completely.
But before you get to that point, right, what can you be doing in your life on the daily to prevent a stroke from even occurring in the first place?
Well, that's a great question. You know, there's a couple things that you can do is that first know the signs and symptoms of stroke, but also you got to take care of yourself. You know, hypertension, diabetes, high cholesterol are the main risk factors for stroke. And you have to take care of your stress levels. You have to sleep better. You got to exercise. I know that you guys wake up really early.
Yeah.
So, but sleep hygiene is actually a increasing factor of helping you reduce your stroke risk.
Getting a good night's sleep.
Yes. No doom scrolling. No doom scrolling.
No doom scrolling. Yes. What I found really interesting, though, is your gum health actually can affect you having a stroke or not having a stroke.
Well,
Meaning?
They actually say that gum health has a high association of cardiovascular risk, but also now there's been increasing studies where oral hygiene is important for not only cardiovascular risk, but for stroke risk.
Why, though, and how?
Because they say that oral health is associated with increased inflammation, and inflammation can cause increased atherosclerotic and plaque buildup in your arteries. Not only in your heart, but it can also occur in other parts.
So brush, floss, mouthwash, all the above.
Yeah, you got to do everything.
Okay, see, dental hygiene kind of leads to other, and more sleep and no doom scrolling. Okay, exercise, got it all. Dr. Law, thank you so much for being here for Stroke Awareness Month.